Good afternoon and welcome to our webcast, where we'll take a close look at how individual coverage HRAs or ICHRAs are good for employees and your bottom line. For those of you who I've not met, I'm Dan Meyer, publisher of BizTimes Media. And thank you for attending today's webcast, which is presented by Quartz, Reinhardt Berner Van Duren, and Zizzle Health, and brought to you by BT360 Content Solutions, the marketing and storytelling arm of BizTimes Media. As employers begin to look at their health benefit options for 2022, many will face another substantial premium increase. In our webcast, our presenters will address how an individual coverage health reimbursement arrangement, ICHRA, offers a cost-effective alternative for employee health insurance for large and small employers. ICHRAs are designed to encourage employees to shop and buy insurance through a robust marketplace of insurance companies and plans, allowing employers to offer customized solutions to individual employees while controlling company healthcare budgets. Our presenters will also provide you with some clarity to issues regarding offering portable, affordable healthcare to employees as a true employee benefit, how and why ICHRAs help you better control your health insurance budget, an outlook for ICHRAs nationally and locally, and how to choose from available ICHRA plans, benefits for remote and non-local employees, regulatory considerations, and more. The slide deck for our program is available now. If you want to take notes and follow along, you'll find the link in the chat button on your screen. It will also be available after the program on our website. At the conclusion, you'll also find a survey for attending, and we would appreciate it if you'd fill that out to help us plan for future webcasts. This past year, we celebrated our 25th year as an independent family-owned business, and BizTimes Media is the only locally owned business media company in the region. And it wouldn't be possible without your support. Whether it's attending events like this, print or digital advertising, event sponsorships, or BizTimes Media's BT360 Content Solutions, I guarantee that we'll work hard to continue to work hard every day to earn your business and to help you grow your business through our custom and integrated marketing programs. If you're interested, please contact our sales director, Linda Crawford. In addition, our award-winning editorial team is always looking for story ideas, especially if your business is expanding or moving, or you're buying another business or building, or if you have any other news, operational insights, or other information you'd like to share. Please let us know so that we can help you tell your story. And last year, we launched our Insider Subscriber Program. For the equivalent of $8 a month, you can be an insider and receive several insider benefits, including access to all the content produced by our editorial team. And it's also your opportunity to support local journalism. Before I introduce the presenters, I want to mention that today's webcast is being recorded and will be available on demand along with the slide deck on our website by tomorrow morning, late morning or afternoon sometime. So now on to the presenters. They include Ray Seaver. Ray is the CEO of Zizzle LLC. Hi, Ray, welcome.
Good afternoon, everyone. Hi, Dan. Glad to be here today.
And Angela McKeegan, Director of Marketplace Products with Quartz. Welcome, Angela.
Welcome. Thank you, Dan.
Glad to have you. And Greg Storm. Greg is a shareholder and employee benefits practice with Reinhardt Berner Van Duren. Hi, Greg.
Hi, Dan. Thanks a lot.
Looking forward to it. So following the presentations, we'll have time for Q&A. So please remember to submit any questions that you have. We've already received several pre-registration questions, but use the Q&A feature on your screen. So let's move on to the program. Here to kick things off is Ray Seaver. Ray, as I said, is the CEO of Zizzle LLC and Zizzle Health. Ray will set the stage for individual coverage HRAs as a health insurance benefit option for employers. Ray, I'll turn it over to you.
Great. Thank you, Dan. Good afternoon, everyone. And we can advance to the next slide. So ICHRAs, it's a funny word, right? But one that I think we all as business owners need to take seriously as we look at managing our health insurance programs and offering quality health insurance options to our employees. And, for years and years, I've been in the employee benefits business for 30 plus years, working both in the small business arena and in very, very large employers. And over, I've heard throughout my career, business owners, business leaders struggling with healthcare costs just asked this question: wouldn't it be great if we could just give our people pre-tax money and let them use that money to buy their own health insurance? And at the end of the day, that's really what an ICHRA allows you as a business to do. It's a very simple concept. It's a very simple idea, but there are going to be a lot of questions as we go about it today, how you can actually get this done and make it a great experience for your employees, and how you can use it from a budget control standpoint going forward. Next slide, please. So where did it come from? ICHRA is a acronym, as Dan had indicated, for Individual Coverage Health Reimbursement Arrangement. HRAs, health reimbursement arrangements, have been around for a long time, and I'm sure many of you have used them in the past as a strategy to help offset high deductible plans, or a way to compensate people for healthcare related expenses. So it's another type of health reimbursement arrangement, individual coverage health reimbursement arrangement. It was created via a presidential executive order back in June of 2019. So we're actually going into our third cycle of ICHRA enrollment. So although it feels and seems relatively new, it has been around for a couple of years, and it's continuing to build momentum. And we'll talk a little bit about kind of what's creating that and the trends that we're seeing as it expands nationally. And it really is a revolutionary way to offer quality health insurance benefits to employees, very different from a traditional group plan, but in many ways, there are a lot of advantages to ICHRAs. Also, some things I do want to state up front: ICHRAs are not for everybody. They are a strategy that we feel as a benefit consultant that you should at least know about, something that you should consider, but it's not right for every situation. But there are many situations where it is the right thing to pursue. So I just want to state that out of the gate. We've all struggled with healthcare costs as business leaders and owners for a long time. We've all seen the different strategies that have been out there, from self-funding to level funding to captives to managed care to PBM programs, to all the things that we have used to try to manage healthcare costs as a business. ICHRA is another strategy to consider, and one that we feel will be around for many years to come. Next slide, please. So just to give you context, when the ICHRAs were first kind of came into existence, the federal government put out some estimations on what it would, how it would impact the federal finances going forward. And they're actually expecting about 800,000 employers covering over 11 million people to be offered ICHRAs over the next 5 years. So this is a significant number, and how accurate is it? We'll see how it is. The bottom line is we're seeing a lot of momentum. We're seeing it pick up a lot of interest around the country, different parts of the country. Some parts of the country, some states are better than others for ICHRA. We'll talk about that a little bit. Wisconsin happens to be a good state for ICHRA. It sets up nicely with the number of insurance companies that are offering products in the marketplace, and how those products are priced in comparison to community rated small group plans. It just sets up for an attractive environment in many parts of the state. Again, because products are offered on a county by county basis. Some counties are better than others. For example, there's historically been a big difference between Dane County and Milwaukee County, where Dane County plans are even more cost effective as compared to small group rates than Milwaukee County plans. So it can vary within counties in a state as well. But needless to say, it's picking up popularity. And we'll see where this estimate comes in, but we do think it'll be a significant strategy utilized by employers. Next slide, please. So trying to keep this as the kind of high level picture of an ICHRA as straightforward as possible. And when I think of an ICHRA, I think kind of like changing from a traditional company pension plan to offering a 401k plan where employees are empowered to use the money that you're providing them to invest where they want to invest it to meet their specific needs. So it's really switching to an ICHRA is a lot like switching from a pension plan to a 401k plan. And so you're still offering a quality benefit to your employees, but they get to choose what works for them. Next slide, please. So as an employer in an ICHRA, you provide your employees a contribution. In many cases, it's a fixed dollar amount that employees can use then to purchase their own insurance plan. And this is one place where I like to stop, and this really does define the difference between an ICHRA strategy versus a traditional group plan. In an ICHRA, employees not only choose the plan, but they also choose the insurance company. So as an employer, we're not in the situation where we have to try to find an insurance company that works for everybody in the company, but we're offering a great financial benefit for them to purchase a plan from an insurance company that works for their specific individual needs. So a fixed dollar amount, so think of it like you're giving your employees an allowance. They can use that allowance any way they like to purchase a health insurance plan that meets their needs. Now, there are some qualifications around the types of plans that are offered. And we'll talk about off exchange plans versus on exchange plans and how that plays into kind of the tax benefit of offering an ICHRA. So an ICHRA does give you the advantage of a pre-tax benefit to employees, both at the employer level and at the employee level. And the way that it is a pre-tax benefit at the employee level is they are required to purchase what's called an off-exchange plan in order to qualify for that pre-tax benefit. So you would have a Section 125 plan in place that covers the ICHRA plan, which would make it a pre-tax benefit to your employees. Next slide, please. So again, driving this point home, employees pick an insurance company and they pick a plan from the insurance company. Now these plans are, many of these plans are they're similar. They're offered at healthcare.gov in Wisconsin, for example, through our state exchange here in Wisconsin, and there are off exchange versions of these plans that look very similar to that. One of the things I want to point out is as we've been moving into the future, these plans are very difficult to distinguish from a lot of the small group and fully insured plans that are available in a traditional group plan marketplace. When you put their benefits alongside a off exchange plan against a small group plan, it's very difficult to tell the difference between them. There are some things related to how networks are configured, which we'll talk about in a moment, but they cover 71 different preventive services and wellness services as part of the benefit at no cost to the employee. So these are quality insurance plans. And again, in a range of deductibles and a range of benefit configurations that allow employees to pick what's best for them. And we'll talk a little bit how important it is to give employees assistance and where they can get that assistance in picking the plan that's right for them. A lot of us as employers have some hesitation about how we provide these benefits. We want to make it easy for our employees. So when you offer an ICHRA, you want to make sure that you give your employees both technology and support from people as well in picking a plan that works best for them. So we'll talk a little bit about that. So employees pick their own plan. Next slide, please. And again, we talked a little bit about the provider network. So these plans each are attached to provider networks. So because there's several insurance companies and several different types of plans, the vast majority of people will find their doctors and their hospitals in a subset of plans that are available to them that they can choose from. So not every doctor and not every hospital is in every insurance company's plan or individual plan, but when you look at the number of plans being offered, they will be represented in some subset of plans available to those employees. So you're getting quality benefits along with doctors and hospitals that people know and trust. And so from an employer standpoint, you're offering, again, a financial benefit that helps people buy insurance, health insurance that's specific to their individual situations. Next slide, please. So we've talked a little bit about this, this allowance, this defined contribution. So in an ICHRA, if you're as a defined contribution, if an employee purchases a plan that costs less than the contribution you're providing, you're allowed to allow them to spend that money on out-of-pocket healthcare services, so co-pays, co-insurance, deductibles. This is an important point. This is one of the budget control levers that can be used to help keep your costs in check over years as employees gravitate towards plans that fit their specific needs. A lot of employees will gravitate towards plans that will allow them to have leftover funds, and then they can use those funds on out-of-pocket costs. And if they spend more than the allowance you're providing them, it's can be a payroll deduction process where it looks just like a group plan from that perspective. And so it is, again, their choice and whatever works for them. If they prefer to have less money coming out of their check, they can do that. If they want a lower deductible with more benefits, they can choose a plan that way and spend a little more out of their check. So it's totally up to them. Next slide, please. So transition results. So when I'm just going to share with you some information, some observations we made in helping employers transition to ICHRAs. I've talked about this, and this is the power of the allowance, the concept, the defined contribution concept. Employees made extensive use of deductible and plan choices. So if an individual had, let's say, 30 plans to choose from, one employee might choose a $8,000 deductible plan, another employee might choose a $900 deductible plan. And what we saw happening was within an individual group, we saw that just kind of fan out. So we had, if you were offering, let's say, a $3,500 deductible plan before, we saw it fan out from $1,000 to $8,000. So your employees would really make use of the plan choices. We just saw the distribution expand across the deductible and plan choices board. And for that matter, from insurance company to the plan they chose. So they really make extensive use of that choice. We also saw participation in health insurance remain stable. So it was almost exactly the same from when we started. And by the way, about a third of our clients that transitioned in last year had never offered health insurance before. So this is, if you're not offering health insurance today, it's a great way to get started in health insurance as well. We saw employees shift away from HSA style plans more into the traditional copay plans. They were looking for more of that first dollar coverage or looking for at least some level of benefit from the outset rather than having to meet a deductible beforehand. So we thought that was interesting when we saw that. We also saw people, a lot of us as employers have looked at spousal carve-outs and incentives to get spouses to stay on their employer's plan, right? What we saw here in this environment happening was coverage tier selections leaned heavier towards employee only versus family. So we saw movement more employee only coverage than we had seen previously in the offering. So another kind of a way that helps reduce cost to the employer. And we also saw employee costs decrease significantly as well. So next slide, please. So this is that cost decrease, both on the employer and on the employee side. So the blue bars represent where employers were coming from before and after the transition into an ICHRA plan, what their costs were. You can see there was a significant difference between the employee costs in the blue versus the orange portion of it. And across the board, we saw savings happening here. Next slide, please. So just a quick case study. I'm going to just breeze through this quickly. So employers that are looking to do several things: maintaining a competitive offering, keeping their contribution at a good level, wanting to capture savings, and then get cost control, predictability. Next slide, please. This is a typical kind of the things that we're hearing what people are trying to accomplish. So because plans are offered on a county by county basis, what we do is we help employers zero in basically on a benchmark plan to help set a contribution. So this is how you start to begin to put your defined contribution together. And so we look at basically the plan design of a benchmark plan up against a current plan to get a sense for, as an employer, am I going to be offering a plan that's similar contribution that would purchase a similar type of plan to what I'm currently offering? Now, as an employer, you can vary that. You can give more, you can give less. It just depends upon what your objectives are. But we like to, you want to start out seeing kind of, if I were to do something similar to what I'm doing today, how does that benchmark plan in a off exchange ICHRA style plan look against the traditional plan that I'm offering today? Next slide, please. And so again, confirming the competitiveness of that plan and just bumping them up against each other to compare them. Next slide, please. And then looking at, okay, if I'm going to contribute at the same level I'm contributing at today, what kind of cost savings would that generate me? So here's an example. This was actually a real case where an employer was saving over $128,000, a 53 employee company that was saving $128,000. So savings can be fairly significant. And again, this isn't going to be the case for every employer. That's why it's important to go through an analysis and see how this works out. And some cases, in many cases, it works out very favorably. In others, it's kind of you're even where you're at, and in others, it might even be a little more expensive. It just depends upon what environment you're coming from and how much claims experience works into your overall renewal of your, and what portion of that plays in your current group plan. Next slide, please. Okay, and so where the budget control then comes in is, again, having that defined contribution in place, having a very stable marketplace of products where we've seen in the last couple of years rates actually go down in this marketplace, then go up. Can't expect that forever. You can never expect that. Healthcare trend is healthcare trend, and healthcare costs are always going up. We can't, demographics are what they are, but it's been a much more stable environment. And once you're in that defined contribution mode, it really helps you go through a renewal process very differently than it does when you're in a traditional just pay for a portion percentage of the plan that you're offering. So that defined contribution really gives you that lever that you need to help you be in charge of where you set your contribution going forward. So I'm going to stop here. I know there's a lot of questions coming in. We'll get to some of those detailed questions here, but I'm going to pass it off to Angela on the plan side.
All right, thanks, Ray. Before we get to Angela, I want to remind you there are a bunch of questions, so we're going to get to those questions after, and we can go to any of these slides if anybody wants to refer back to those. The slide deck, as I mentioned, is in the chat, as well as the program is going to be recorded and available on demand tomorrow. So next is Angela McKeegan, Director of Marketplace Products with Quartz. Angela will help us to understand how Quartz is an integral part of the health insurance and health provider ecosystem. Angela.
Great, thanks, Dan. So Ray did a fantastic job, and I'm sorry, Mary, you can go on to the next slide. Thanks. Ray did a fantastic job covering the benefits and ICHRA can provide, and how agencies just like Zizzle Health can help in offering an efficient and cost-saving solution to employers. I'll dive into the plan types that are available for employees to choose from, discuss nuances of the individual and family products that are different from employer-sponsored plans, and expand on the advantages employees gain by being offered an ICHRA. But I just want to first quickly introduce Quartz. We are provider owned by the Integrated Healthcare Delivery Systems of UW Health, Gunderson Health System, Unity Point Health, and Advocate Aurora. Quartz' provider owners take on financial risk to share in the benefit of healthier patients. Our contracting agreements are structured to ensure providers rely on data and evidence-based practices when making decisions by providing incentives to help patients to keep patients healthier, and in turn, making care more cost-effective. By working closely with our provider owners, we give members access to a medical home with appropriate primary and specialty care while focusing on prevention and wellness. Next slide. Quartz offers a variety of health plans in several different market segments, which include employer groups, including both large and small corporations with fully insured and self-funded options, government lines such as State of Wisconsin Employee Trust Fund and Federal Employees Health Benefits, and individual selection products such as individual and family plans sold both directly through Quartz or through the health insurance marketplace, Medicare Advantage, Medicare Supplement, and Medicaid or Badger Care Plus plans. For the remainder of our time today, we'll focus on the individual and family plans line of business. Next slide, please. While these individual plans are not our largest population of members that we serve, we take pride in the quality product we offer on and off the health insurance marketplace and invest in providing our members an exceptional customer service. What makes Wisconsin unique is the local and regional health plan options. But local doesn't mean small or narrow. Although Quartz is a local HMO, we have a robust network of high quality providers and offer individual and family plans across an expansive footprint in 3 states in the upper Midwest. In 2022 benefit year, we'll be expanding our service area to 18 additional counties, bringing accessible, high quality, and affordable healthcare to more consumers in eastern Wisconsin. Unlike employer group coverage, which is offered based on where the employer is domiciled, individual plans are specific to the county in which the consumer lives, and these plans are designed with folks just like them in mind. Plan offerings vary by geography to ensure we're meeting the needs of consumers in each region and are backed with an adequate network of providers that allow each employee to find care local to where they live. This is increasingly important as more and more employers move to a remote workforce and employees may be scattered all across the state or even country. Next slide, please. Along with a robust network of providers, these plans offer comprehensive benefits and coverages. All individual and family plans must include all 10 essential health benefits, or EHBs, which include coverage for prescription drugs, hospitalization, emergency care, mental health, $0 preventive and wellness services, and so much more. Additionally, many health plans include benefits beyond the EHBs, such as adult dental coverage. We know not all consumers have the same healthcare needs. That's why plan designs and cost-sharing structures have a very broad range. Just like in the small group market, the actuarial value of each individual plan must meet a certain threshold to fall within a metal tier. This actuarial value estimates how much the plan will pay versus how much the member will pay on average when utilizing their health plan, as referred to in the chart shown on the right of the screen. In the individual market, there are several plans to choose from in the gold, silver, and bronze metal tiers, covering a wide range of deductible, copay, and maximum out-of-pocket amounts. Although platinum plans aren't common, they do exist in the individual market. Gold plans with a lower deductible and office visit copays are available for those who prefer to pay less out of pocket when seeking services from their healthcare provider or filling their prescription. Others may feel more comfortable with a lower monthly premium and a higher deductible plan in the bronze level. At both ends of the spectrum, consumers can find plans that can be paired with a health savings account or an HSA for even more savings. And regardless of the cost-sharing amounts associated with the plan, remember that all these plans cover preventive and wellness services at no cost to the member. Next slide, please. So you can have peace of mind while offering your employees an ICHRA, because individual and family plans are very heavily regulated, and these requirements are aimed at protecting the consumer. Rates for each available health plan are calculated for a consumer based only on the county they live in, their age at the time they enroll, and whether they use tobacco. Rates do not vary by health status, meaning that for the same plan, a very healthy 30-year-old non-smoker living in Milwaukee County would pay the exact same premium as someone with those same demographics, but who is currently battling cancer. In addition to not having a rate increase for their historic or current health condition, consumers are protected by guaranteed issue and guaranteed renewability requirements, which means they cannot be denied coverage upon application, and they are guaranteed to be renewed for as long as their carrier offers coverage in the market and the consumer meets the eligibility requirements. I want to be very clear here, as there's no fine print to watch out for. Consumers will remain eligible as long as they continue to remain in the county in which the health plan is offering coverage, the health plan continues to offer individual coverage in the market, and the monthly premiums for the plan are paid timely. On top of the rate rules and guaranteed enrollment, there are also no exclusions for coverage of pre-existing conditions. Coverage benefits and services don't carve out care or treatment for any medical condition which originated prior to the plan becoming effective. There's also no cap on the amount the insurance company will cover or an annual or lifetime basis. As a general rule, to know you're enrolling in an individual and family plan, if you have to answer any questions regarding your past or current health status, that's not an individual plan. Next slide, please. This is where the win-win of an ICHRA really comes to light. Have you ever tried to make everyone happy and failed? An ICHRA puts the decision-making in the hands of each employee, and choosing a plan is no longer a one-size-fits-all approach. The employees can choose their health plan and make a personalized choice for themselves or their family. Wisconsin in particular is a very competitive market with more carrier options than most other states. Quartz is just one of them. Employees with access to a wide range of health plan offerings. So with the set employer contribution to the ICHRA, each employee can decide how much they want to pay out of pocket in addition and choose a plan that meets their budget. They can find a plan that includes a doctor that they already have an established relationship with in network. And they can get down to the nitty-gritty details and look for a health plan that covers their specific prescription drugs at the lowest cost to them. And the best part is they get to make that decision every year at renewal. As their family needs change, they can change their health plan to match their anticipated needs for the year ahead. The employee is truly the policyholder. They own the plan and can continue to stay enrolled on the plan even after their employment has ended, provided they continue to make timely premium payments. So choice, and more choice is the theme for the consumer purchasing individual coverage with an ICHRA from their employer. And an ICHRA has potential to give the member more support beyond just a contribution toward their monthly premiums. This is an important point that Ray mentioned earlier, so I just want to highlight this again. Members may be able to purchase a plan for less than the employer contribution total based on what their needs were. They can use any of the excess funds towards the cost of healthcare, such as paying for their office visit copay. An individual coverage HRA is a great option to consider when employer-sponsored health plans are out of reach within the budget or you don't find or it doesn't fit your employer needs. The benefits on both sides for employers and employees should simply not be overlooked. Thanks, Dan.
Great, thanks, Angela. I can't wait for the questions. There are a whole bunch of them in the chat or the Q&A, I'm sorry. Keep putting those in, we're gonna address those, but before we go there, Greg Storm is our final presenter, and he's a shareholder employee benefits practice with Reinhardt Byrne Van Duren. And Greg's gonna help us to understand some of the legal requirements related to individual coverage HRAs. So Greg.
All right, thanks, Dan. And we've reached the point in any program that includes an attorney on the panel where the attorney throws cold water on all of the great creative solutions that you've heard about already. Now, the good news is I'm not actually going to completely undercut the entirety of this presentation, so you haven't been wasting your time listening. But of course, with anything that involves tax rules, there are a lot of technical requirements to make sure that you're offering a compliant ICHRA. And I'm going to touch on at least a handful of those ones that we see most frequently arising as issues for employers as they implement the ICHRA solution. So next slide, please. And we'll start with a little bit of history here just to understand exactly why ICHRAs came about and why some of these requirements were necessary. So going back to what seems like the Stone Age of the pre-ACA world, some employers, at least we're aware of some, that did actually offer some sort of an individual reimbursement arrangement. They might offer a standalone HRA or health reimbursement arrangement that could provide some amount of tax-free benefit for their employees. The IRS and the Department of Labor always treated those types of arrangements as group health plans. And that's an important concept to remember as we move forward into the ACA world. When ACA was passed in 2010, it included, as we know, a number of different requirements that applied to group health plans. And since HRAs are group health plans, those requirements applied to HRAs. And two of those primary requirements that you're probably familiar with in the group health plan context are the requirement that a group health plan under ACA cannot impose an annual or lifetime dollar limit on the benefits provided through the group health plan, and that a non-grandfathered health plan has to provide 100% coverage of preventive services through the group health plan. Well, if you think about the concept of what an HRA is meant to do, it's meant to provide a limited bucket of money available for reimbursements or for benefits for individuals who are employees of a particular employer. So that naturally rubs up against the ACA rule on prohibiting those lifetime benefit limits. So what we saw in 2013 was the IRS issuing guidance stating that an HRA or an employer payment plan must be integrated with a group health plan. And then correspondingly, the HRA now linked together with that group health plan gets to rely on the group health plan to satisfy those ACA requirements. At this point, we essentially ended up killing off the standalone HRA idea for active employees. There's an exception that applies for retirees. Then we move forward a number of years and we get to 2019. And as Ray mentioned, we had an executive order, and that was followed by regulations jointly issued by IRS, DOL, and the Department of Health and Human Services that basically extended that 2013 guidance that I mentioned here in the second bullet to the individual world in creating the ICHRA and saying that an HRA or an ICHRA can integrate with qualifying individual market coverage or Medicare, and that correspondingly can help satisfy all of those ACA requirements. Here, the ICHRA is relying on the individual coverage, and Angela did a good job of detailing the value of the individual market and highlighting some of those other ACA requirements to satisfy those rules and create a compliant program. Next slide, please. So there are a few additional requirements that I want to go through in the next few minutes, and we'll start with substantiation. As we know, to have a valid ICHRA, you have to have individual coverage either in place at the time that the ICHRA becomes effective or on an ongoing basis for the beginning of a particular plan year. And you need that coverage in place to be able to receive those reimbursements or to get that tax benefit that Ray was talking about earlier. Now, how can you demonstrate that the person actually has individual coverage so that they can receive that tax benefit? You have a substantiation process. And substantiation proves the ability of the individual to receive money and receive reimbursement from the ICHRA. So correspondingly, the ICHRA itself and the employer that's offering the ICHRA must have procedures in place to substantiate that each ICHRA participant is actually enrolled in individual coverage. A failure to substantiate results in the ICHRA not satisfying these requirements. The failure to satisfy these requirements means you lose the benefit of all of that pre-tax and tax-free reimbursement And correspondingly, the ICHRA reimbursements should be treated as gross income to the individual. And now the employer has to correspondingly pay payroll taxes, make proper reporting, et cetera. And it's all of the things that normally go along with providing taxable income to your individuals and your employees. How do we see substantiation moving forward or playing out? Well, it can be in one of two forms typically. Documentation from a third party. So the carrier is confirming that yes, Ray is enrolled in individual coverage, or through a participant attestation. And that participant attestation might take the form of a reimbursement request. So when an individual requests that money be paid to him or her because of out-of-pocket expenses being incurred, there's an attestation that goes along with that reimbursement request that confirms that for that month in which expenses were incurred, the individual was actually enrolled in individual coverage. In addition to the initial substantiation requirement at the beginning of a year or when coverage begins under the ICHRA, there's an ongoing substantiation requirement that's involved. So for each time that an individual makes a reimbursement request, substantiation has to be proved. And we've worked with Ray on some ways to facilitate an easier way to demonstrate substantiation related to premiums on a going forward basis. Basically relying on some of the language that's included in the regulations preamble to allow employers to make payments directly to carriers from the ICHRA and facilitate that regular substantiation process. You still need to see that perhaps there's an invoice that's going to the individual, but the employer or the employer's vendor or delegate can make that process easier for the employee. Next slide, please. The next key legal requirement is that an ICHRA has to provide the same terms and conditions for all employees that are included within a particular class. And on the next slide, we'll talk more about what are the permitted classes of employees. But for right now, I just want to focus on what does this mean to provide the same terms and conditions. The agencies are concerned with, and the IRS in particular, doesn't want an employer to provide a better benefit typically for executives than is provided to the rank and file employees. So accordingly, there's generally a requirement that the same type of ICHRA benefit, the same type of contribution has to be provided to everybody. There's a little bit of variation that's allowed through some of the exceptions that are included within the regulations and which I'll highlight here. First of all, contributions can vary by the age of the individual or by family size. And what we mean by that is that there is some age banding that can go on whereby the oldest individual can receive an ICHRA contribution or allocation for a year that is not more than 3 times the amount of the allocation that's provided to the youngest person within that particular class. Similarly, because a single employee with single only coverage may have and should have a much lower premium rate than a employee plus 1, employee plus 2, full family. The regulations do allow for employers to vary the contribution or allocation to the ICHRA based on the class of the family size. Carryover amounts are another element of ICHRAs or HRAs in general. As a general rule, HRAs do allow amounts to carry over from year to year if they are unused. So HRAs, unlike your FSAs, are not subject to the use it or lose it rule. Employers aren't required to allow for carryovers, but they can allow for carryovers within an HRA and correspondingly within an ICHRA as well. So when we're talking about same terms and conditions, if in 1 year, at the end of the year, I've got $1,000 left over in my ICHRA and Ray has $1,200 left over, and they both carry forward into the next year, that's not a problem under the ICHRA rules. That variation in the carryover amount is disregarded. As a general rule as well, the IRS and the agencies would like to see a flat dollar amount included in the contribution amount. And Ray talked about kind of targeting reaching that percentage of an employer payment. And that's kind of something that can be worked out as you're going through the strategy element of creating the ICHRA amount. And this last bullet here is probably the biggest key thing to keep in mind under the same terms and conditions aspect, which is that a group health plan option, if offered to one of the classes, cannot or essentially negates the ability to offer an ICHRA to the employees within that same class. And that's a pretty common question from some employers, to say, well, can we give people the choice of going into an ICHRA or choosing our regular traditional group health plan? And the answer is no, at least not within that same class. So next slide, please, and we'll get into those permitted variations and permitted classes. And the first 5 bullets here are really the ones that I think most employers are most concerned about, to allow for a variation in benefits under an ICHRA. Full-time employees, and full-time basically means the ACA definition, working 30+ hours per week. Part-time employees, salaried employees, hourly employees, employees whose primary site of employment is within the same rating area. And I'm not going to list out the rest of them, but like I said, the first 5 are the main ones that tend to matter to most employers. So when we say that permitted classes are allowable, what that means is you could theoretically, as an employer, offer a traditional group health plan to all of your full-time employees, and then offer an ICHRA to your part-time employees. You can't offer both to the full-time, you can't offer both to the part-time, but you could offer one to one class and one to another class. In addition, classes are determined or are divided up at the common law employer level and not at the controlled group level. What that means is, if I'm an entrepreneur or business owner and I own more than one company, I own company A and company B, instead of thinking of dividing up classes on a combined employee basis between company A and company B, I look at dividing classes up within company A and within company B. And that's a little bit unusual. For those of us that are practitioners in the benefits world, we're usually thinking about combining employees within controlled groups and across multiple companies, rather than being able to divide within each individual company. There is also a requirement that a minimum class size may apply if you're offering a traditional group health plan to employees in one of those first 5 bullets listed above. Then the ICHRA that would be offered to another class of employees has to have a minimum number of employees. What the IRS and the agencies don't want to see is you have 2 part-time employees and 100 full-time employees. You offer the traditional health plan to your 100 full-time employees, and the only people who are offered the ICHRA are the 1 or 2 part-time employees. So the minimum class size is generally that you have to have 10 employees in a class if you have fewer than 100 employees. If you have between 100 and 200 employees, then it's 10% in the minimum class size for the ICHRA offering. And if you have over 200 employees, then it's just a flat 20 that must be in that minimum size requirement. Next slide, please. And we'll end the legal portion, keeping it hopefully not too painfully long, keeping it brief, with circling back to the ACA. The ACA was kind of what drove, in some parts, the creation of the ICHRA guidance, as I mentioned earlier. And as I noted, the idea for satisfying many of the ACA's requirements is that the ICHRA integrates with qualifying individual coverage to satisfy so many of those ACA rules. Now, the offering of an ICHRA in and of itself does make an individual ineligible for the premium tax credit. Remember that I mentioned earlier that an HRA in general, and an ICHRA as well, is considered a group health plan. And if you offer a group health plan that is considered minimum essential coverage, which an ICHRA is, an individual is ineligible for the premium tax credit, subject to a couple of rules here. Correspondingly, the ICHRA must allow employees to opt out of the ICHRA offering and waive the right to receive benefits under an ICHRA for a particular year if that individual instead wants to go on the exchange and potentially receive a premium tax credit by purchasing exchange coverage. Now, if the offering of the ICHRA is at a level that is considered affordable under the employer share of responsibility rules, then the individual cannot receive a premium tax credit regardless of whether the individual opts out of the ICHRA offering. And for those of you that are over 50 full-time employees, you're familiar with the ACA's employer shared responsibility rules. It's the requirement that an applicable large employer, an ALE, must offer qualifying coverage to avoid all ACA penalties. Offering an ICHRA does count as an offer of an employer-sponsored plan for this purpose, as I mentioned. And then affordability and whether the coverage is considered affordable is determined based on the lowest cost silver plan offered on an exchange. And how would that calculation work? Well, essentially, you take the cost of self-only coverage for that lowest cost silver plan, you subtract the ICHRA benefit for a particular month, and that remaining amount is what the employee is considered to pay for the ICHRA employer offered coverage. If that employee payment amount is less than, for 2022, 9.61% of the employee's household income, then it's considered affordable. And correspondingly, the employer, if the employer is over 50 full-time employees, has satisfied its employer shared responsibility provisions and requirements and will not be subject to any penalties. Correspondingly, as I mentioned, the individual is not eligible for a premium tax credit. So next slide, and I think that brings us to the end of my portion. I know, Dan, we've got a lot of questions to
We
get
sure
into.
do. So I have one quick question as you're talking about the legal requirements, and then for the panelists, I think we'll run down all the questions or as many as we can that were submitted during the program. And then we have those that were submitted prior to the program and then a whole bunch of other ones. So let's get right to it. So, okay, let's say I want to go ahead with an ICHRA, but I'm worried about the legal requirements. How do I proceed with without the fear of kind of stubbing my toe and it's like, oh, that's great, but you didn't meet the requirements, two of the several requirements that Greg just talked about. How does that work?
Sure. So I think you're going to have to be working with an advisor or vendor that is familiar with ICHRAs, whether it's your consultant or broker or your legal counsel. Either one of them should be able to provide a compliant explanation of what you need to do. You're going to need to put together a written plan document. That's a requirement for any group health plan under ERISA, and ICHRAs are subject to ERISA as group health plans. So that written plan should govern what the nature of your ICHRA benefit is. And you're going to want to be working with somebody who's familiar with ICHRA so they can make sure that you're checking all of those boxes and ticking everything that's necessary to ensure that you're doing so in a compliant manner.
Great. Okay, let's get to some of these questions in the Q&A. Is the excess payroll deduction, if plan costs more than the employer funding, still pre-tax?
Yes. It
Great.
is, and in order to do that, they need to buy an off-exchange version of the plan and have a Section 125 plan in place.
Okay. What do you think about offering an ICHRA by an employer that has employees across the country in every state?
So there are national solutions available to accommodate that. Most of those solutions today run on what's called a reimbursement model, where employees have to request reimbursement each month to receive that reimbursement. Although over time we see solutions developing where it can be more of the traditional employer pays the premium on behalf of the employee, meeting the attestation requirements of the carriers, and looks more like a group health plan to employees. So today we're mostly seeing the reimbursement model, which can work well for an employer that has a number of employees in one state and a handful of employees in other states. That can still work out very well. But that is one of the criticisms that ICHRAs receive on a national standpoint, is the employees in a reimbursement method that's run are required to front the premium. But again, I want to stipulate that in many situations, if you have the bulk of your employees in one state, you can run a reimbursement method where the carrier's reimbursed by the employer on behalf of the employee, and it looks just like a group health plan to those employees.
Okay, this one might be for Angela because of the medical provider aspect of it. Do you think that medical providers prefer patients with private insurance rather than patients with marketplace plans?
So marketplace plans are private insurance. It is still a commercial plan. And so carriers go to providers and negotiate a reimbursement rate on those plans. The reimbursement is not set by the government or any other institution. So from their perspective, it does not matter.
Okay. Do leftover funds, we might have answered this already. Do leftover funds carry over in the employee account from year to year, or are they use it or lose it? I think it has to be in the same class.
That is a provision within the plan document. So an employer can specify whether or not they want to roll that money over or not. So that is an option that the employer can put within their plan document.
Okay.
We're seeing most employers not do that, that the money is returning, but that option is there.
Okay. Is the employer contribution intended to be the same regardless of family tier?
So maybe, well, Angela, you might want to add some color to this, but so rates are different in the individual and family plan. They're a lot like small group plans where they're age rated, right? So there's a different rate for each person depending on your age. The rates vary by age, the county in which you live, and in some cases, whether you use tobacco or not. There can be a surcharge with tobacco, right? So families rates in the individual and family plan environment are comprised of the cost of premium for that employee, the cost of premium for their spouse, and the cost of premium for their 3 oldest children. So each child has their own rate as well. So it's not a one-to-one kind of traditional family, employee spouse, and employee only type tier of coverage. The premium is comprised of the sum of the individual premiums. And maybe you can simplify that, Angela.
You hit the nail on the head.
Okay.
It is exactly the same rating as an ACA compliant small group plan,
Right.
where it's added together for those that are enrolling on the same plan.
So you said age rated, but overall, these are community rated, not experience rated, which,
Correct.
if I'm not mistaken, that's a huge benefit. If you had cancer or were diagnosed with diabetes, you're not going to get an 80% increase the following year.
You want to answer
Correct. Yep, that's exactly correct. So everyone in the market, right, we put through a % increase, and yes, it does impact individuals differently depending on which plan they choose. And when I say plan, I'm specifically talking about the gold plan with the $20 copay. So depending on which plan they choose, they will get a renewal rate for that plan, but that same increase is applied across every individual that's on that plan.
All right. Can you talk about how ICHRA plans are reported for ACA purposes?
Yeah, so it's Greg, do you want to do that, or do you want me to do that?
You can go ahead and I'll supplement.
Okay, great. So it's they meet ACA compliance. So we go through an analysis with each client on where they need to set their contribution to make sure they meet affordability, because they meet minimum essential coverage. So they meet that requirement out of the gate. So it is incumbent upon your advisor, your consultant, your accountants, your attorneys to help you determine whether or not they meet the affordability standard. And we go through that process with clients and ensure that they are.
And then specific to the reporting aspects, you are required to report the ICHRA itself on the Form 1095-Cs that are filed with the IRS and then issued to your employees if you're a large employer. And along those lines, I know that the IRS revised the 2020 forms to add some additional color in the instructions to note exactly how you should flag certain things for ICHRA purposes as you're doing that ACA reporting.
So who tracks how much the employee uses or leftover funds? So from what I'm gathering, this would typically be kind of an administrative thing in a traditional plan that the employer would have to deal with, but who tracks this in an ICHRA if there's leftover funds?
So there are a number of TPAs that just for like FSA, flexible spending accounts and traditional health reimbursement arrangements are doing this tracking. So it works very similar to if you're using a FSA today or an HRA today, it works basically exactly the same.
Okay. What if an employee has a dependent who lives in a different state? Can they find a family plan that covers local and national providers in network?
Angela, do you want to answer that first?
Yeah, sure. So there are local and national providers that participate in the marketplace. It really just depends on what is available in your county. So depending on the county, you may have access to a national provider that is offering a plan that has a national network, or there may only be local provider and carriers with local providers in their network.
So it's important to understand what's being offered in your area and the counties in which your employees live. But and I would just reiterate, so there are options available for in most situations where people have the ability, if that's what's important to them, they can choose a plan that has that benefit.
Okay, great. In the event an ICHRA participant terminates employment, which is oftentimes the case, does COBRA apply? How does that come into play?
It does apply. And so an ICHRA is a COBRA eligible plan. So ICHRA is not health insurance, but it is like an FSA. It is a COBRA eligible plan. From our perspective, it doesn't make a lot of sense to participate in that because in most cases, an individual ends up paying a 2% administrative fee on top of the premium they're paying in order to secure that coverage. So the good news about these plans are they are individual plans. The individual owns that plan. They can continue to pay their premium and keep that plan going if they desire to do that. So that's one of the benefits of an ICHRA.
There was a follow-up question, and you might have answered it because it's an individual plan, but what are the mechanics of this? Who gets the premium invoice?
So the individual gets the premium invoice. So this is something that it takes some education with employees and something that is provided. So employees are made aware that, hey, you will receive an invoice each month from your insurance company. We happen to be on an ICHRA at Zizzle. I get my health insurance invoice every month, and I see that my employer paid my premium the previous month, and there's a $0 balance, but it's telling me what my invoice is for this coming month. And so I just see that process happen every month where it gets zeroed out and then I see what the cost is for this month. So they do get that invoice. You know, from an employer, what I like about that is that my employees are seeing every month the total cost of their health insurance, and it really drives home the level of benefit that you're giving them as an employer with that ICHRA contribution and how valuable that really is.
And I think you answered this. Is the funding annual or periodic? Is the whole amount available day one like FSA?
Greg, I don't know if I'll put this in the right legal terms, but so you might want to supplement here, but plan documents usually stipulate that the amount is granted each month so that it's not a whole amount out of the gate. They're getting it each month that they are eligible to receive it. So it's not something that they could spend in advance. Greg, do you want to?
Yep, that's correct, Ray, that it's really up to the employer to decide if the employer wants to make the entire annual amount available all at once in an HRA. It can do so, but it is not required to do so. And correspondingly, most employers don't, because they don't want to run into the situation where they had to make everything available. Somebody uses the entirety of it, and then they end up terminating.
Right, and I would echo that. We see most employers opting to do the periodic.
All right, so this individual has two questions. So if the rates are all different, how does the employer decide how much money to contribute? And then she said, I'm confused. Why is the employer paying the entire cost of monthly premium?
So the first part of that question is that's the contribution strategy. So your consultant, your advisor will work with you to determine what that contribution amount would be.
That's consistent, right? That's the same every month for everybody.
Yep. Well, it's the same amount for each individual that's of the same age. right? In some cases, there are different strategies that can be used, Dan. There's several different strategies that can be used to do this. We favor an age-rated strategy that matches how the premiums go up for each individual. So we determine a contribution amount for each age band, which each age band is 1 year in our environment. So that's the way we do that, ensuring that the oldest person doesn't get 3 times more than the youngest person, right? So it's an age banded contribution table, basically, is what it is. All right. And then the way the employer might be paying the entire premium is because there are different prices for different plans in the marketplace. And if an individual selects a plan that costs less than or costs the same as the employer is contributing to them, you may end up funding 100% of the premium in that situation. In other situations, employees may be selecting plans that cost more than the contribution you're giving them. Then you are not, as an employer, funding 100%. So that's the beauty of the defined contribution. People can pick what they want, and again, we believe it helps you maintain the budgetability of this approach over the long haul.
Can an HSA be used as the funding vehicle for the ICHRA plan?
No, the HSA itself cannot be used to fund the ICHRA. Now, you can create a potentially HSA compatible ICHRA so that the HSA is there to, essentially when you think about an individual has to be in a high deductible health plan to be able to qualify to put money into an HSA. So then you have to make sure that your ICHRA is available either for only premium amounts or for reimbursement of deductible out-of-pocket expenses after you've exceeded the high deductible amount. And I think when you start to get into that level of complexity and administration, I think some employers have just chosen not to really go that route and worry about making it HSA compatible.
Mm-hmm. If a terminating or terminated employee has carryover funds in their account, will they retain access to those funds after termination?
I think again, that's an employer decision as to whether or not the employer wants to allow the HRA amounts to be available post-termination. Now, they have to be available post-termination for amounts and expenses that were incurred prior to termination. Right. But if you want to say, and again, this kind of goes back to the COBRA question, that typically you'd have to pay the COBRA premium to be able to continue to access the ICHRA amounts on a post-termination basis for expenses that were incurred after termination.
Yeah, so again, we see most employers, those funds return to the employer after termination unless an individual elects COBRA.
Great. What happens if you fund an employee who ends up not paying their portion, assuming the employee selects a plan more than the company contribution?
Ask that one more time.
What happens if you fund an employee who ends up not paying their portion, assuming the employee selects a plan more than the company contribution?
So again, there's two kind of prevailing models out there. One is the pure reimbursement model, where an employee pays their own premium first and then requests reimbursement, and the HRA through the employer is that money is sent to them. The other model is like a traditional group plan, just like most of you are doing today, where the company is paying the premium on behalf of the individual and then payroll deducting that amount. So
that's what you favor, isn't it? Isn't that what you favor?
That's the model we favor, because we don't think a lot of employees are going to like having to front the money for their health insurance. So if you have a payroll deduction process in place, so your payroll system, you should never be in that situation, bottom line. So,
but if you don't, and if you go the reimbursement option, I mean, Angela, I'm assuming that if somebody doesn't pay their premium at a certain point, their individual coverage is terminated.
Right.
And then we're into a situation where the individual no longer has individual coverage, and essentially doesn't satisfy one of those requirements to be able to receive the ICHRA reimbursements anymore. That's kind of tying back on the substantiation rule that I was talking about earlier.
Right.
Angela, the individual market has an annual open enrollment, the OEP. So does an ICHRA need to align with the OEP in order for employees to enroll in individual coverage?
No. So all individual plans run on an annual basis from January 1st to December 31st. And an individual can join an individual plan at any time during that time period if they are being offered an ICHRA from their employer. However, it doesn't start the 12-month period for their plan year on the day that they enroll. So if they enroll on July 31st or on July 1st, they will have 6 months of coverage on that year, and their plan selection will reset on January 1st of that next year.
Great. Greg, are there any notice requirements associated with ICHRAs? I think you might have talked about that, but I can't recall.
Sure. Yeah, there are specific notice requirements that are part of the ICHRA rule. You have to provide an annual notice to the individual that explains the nature of the ICHRA, the benefits that are available, the maximum allocation or contribution amount that's made, as well as that right to be able to opt out of the ICHRA that I mentioned earlier. All of that is part of the notice requirement, and there are model notices that are available for employers. You have to provide that notice 90 days prior to the beginning of every plan year. And in addition, you're supposed to provide it if you're within 120 days of when you first adopt an ICHRA, just provide it as soon as possible, as long as you get it out before the ICHRA becomes effective.
Here's an interesting question. Can you transfer an HSA balance to a new ICHRA plan? An HSA balance to a new ICHRA plan.
Right. So, you know, like one of the things I think we always want to think of is an HSA is essentially the HSA that's owned by an individual is it's like an IRA. It's owned by that individual alone. The ICHRA is really a group health plan. You know, I know it's this weird hybrid, right, that we keep talking about of a group health plan that's offered by an employer that then has an element of the insurance portion of it being individualized. The HSA itself is truly owned by the individual. So you couldn't really take an individual's HSA and transfer that over into the ICHRA. The ICHRA itself, and one of the requirements for any HRA, including an ICHRA, is that it has to be funded by employer dollars. So you couldn't take an HSA that really belongs to the individual and use that to fund the ICHRA itself.
But Craig, if an individual buys an HSA qualified plan as their individual plan, they could use HSA dollars that they have accumulated earlier to help offset their out-of-pocket expenses, correct?
Their portion of the out-of-pocket expenses could then be reimbursed by the HSA as long as that's an HSA.
And I'm wondering if that wasn't the question about, yeah, you can use HSA funds through an ICHRA if you own an HSA qualified plan through the ICHRA.
Right. I agree.
I've seen this question before, and Angela, maybe I think you mentioned some of this, but you know, the employer, you know, the whole wellness and well-being is such an issue. And if I have healthy employees, my insurance premiums are going to maybe not go down, but they're not going to go up as fast. How does an ICHRA come into play as it relates to preventative care, you know, incentives to stay healthy? You know, and now it's my employees' responsibility is their plan, and they're off the traditional employer plan. How do I know that they're taking care of themselves and they're seeing the doctor and they're doing their well visits?
Yeah, I mean, I guess you really don't, right? Know that they're seeing the doctor. That's really on the insurance company and the individual consumer at that point, right? To make sure that we're educating the consumer on the benefits of the individual plan. We also, as the individual insurance carrier, want the employee to be utilizing their benefits. We don't just want it to be for catastrophic events and that coverage. We want them to be healthy employees. So from the carrier's perspective, we really do our best to make sure that we are educating our consumers on how to utilize their plan not just for coverage when they need it, but making sure they stay healthy.
And courts, I mean, and others, there's wellness components to it's available, isn't it? And even doctor visits, annual doctor visits, there's an incentive where it's low or no cost from potentially. Are those kinds of incentives in place for an individual to say, hey, it's not going to cost me anything, or it's going to cost not that much. I need to go get my checkup.
Yep, preventive and wellness services are covered at $0. So we do abide by that ACA requirement. And then several carriers also have wellness programs that members can participate in. So to courts, it doesn't matter if a member comes to an individual plan simply because they're purchasing on their own or they're purchasing through an ICHRA. They are still an individual member and eligible for all of our wellness benefits.
Mm-hmm. You alluded to this earlier, and you might have talked about it a little bit as a group, but Ray, you said, ICHRAs are not for everybody. When is it not appropriate? At what point where it may not make sense?
Yeah, I think so. Companies that are above 50, that are experience rated and extremely healthy, and it may not be in their financial interest to transition to an ICHRA. It may not make financial sense for them to do that. So in that situation, it would come down to whether or not just the concept of getting out of the business of having to put that much effort and thought into managing the plans that you want to offer to people each year and managing the benefits, and what does it take to do that every year. Maybe getting out of that, it makes is attractive, and that would be a reason why you would consider it. So when I made that comment, I guess I was being sensitive to the fact that we talk about ICHRAs many times being financially in a company's interest to make the move. That's not always the case. And it's something you need to look at, but there are other reasons why those companies may want to transition to an ICHRA, just to simplify the whole health insurance offering, and because they like the concept of offering way more choice and letting employees pick what's best for them. I mean, we've seen several companies, quite honestly, we're quite surprised when we went through our first enrollment session last year about how much employees really like the ability to choose what was right for them. And that can be a cultural, it can be a way to attract and retain talent as well. So, so that might be a reason, but it's not always in a company's financial interest to transition to an ICHRA.
Right. The culture might be favorable because you're giving them control rather than just giving them one option or an option that they can buy up to.
Right.
Angela, there's some questions regarding subsidies and things like that. So does money paid to an employee by an ICHRA lower the amount of the subsidy they are eligible for through the marketplace? And then, what's the benefit of offering ICHRA over not offering coverage to all, at all, and my employees being eligible for the marketplace subsidies?
Yeah, so Greg can keep me honest here. So with the ICHRA being an employer-sponsored plan, if you are offering an ICHRA, your employees would then not be eligible for APTCs as long as the contribution meets the affordability threshold. And so if they have an ICHRA available and they opt in, then they are not eligible for APTCs, so they cannot use those to purchase a marketplace plan. The benefit of offering an ICHRA over not offering an ICHRA at all and just sending your consumers to the marketplace, I think that was the second part of the question there. So it's important to remember that APTCs are determined based on the household income. And so if we're looking just at the employees in your corporation, they may have a spouse who's earning income but doesn't have access to employer-sponsored coverage as well. So we really have to look at it from the household perspective and make sure that, just because you don't offer that ICHRA or you don't offer benefits at all does not mean that they're going to automatically be eligible for APTCs through the marketplace to receive lower premium. And then obviously, offering benefits such as health insurance is really one of the leading considerations in trying to capture quality talent for your organization.
How
Dan,
does,
can I just add, interestingly, so we're seeing in like the state of Colorado, some pilots going on with them combining the tax credits and ICHRA contributions together. So there's some discussion about that. It's not prevalent at this point. I just find that interesting, though, that there has been some piloting of that going on in another state. So.
how do you evaluate exchange plan network viability / robustness without the ability to do geo access reporting? I'm not even sure if I understand that question, but I'm sure you all do.
Yeah, do you want to do that, Angela?
I'd love to, yes. So in order to offer individual coverage in any state, there are network adequacy requirements. And so we don't get handed over a census that we can run geo access analysis through, but we do estimate what membership is going to be and submit, this is going to be the service area that we're going to support with our individual product and have to get regulatory approval. So there is some restrictions and there's some, protections out there to make sure plans aren't offering a very narrow network that is not going to be adequate to the consumers.
Yeah, and if I can add to that, I saw another question coming through about how do employees get help selecting a plan, and this kind of all plays into it, right? So having an advisor that can that knows the local market, that knows the local carriers, knows the networks that are attached to those plans, and is familiar with that, and can help employees determine whether or not their providers are in network or not, or which providers are in network or not, is very important. There are some technology tools as well that help shortcut that process and get to an answer faster. So the combination of what we call a concierge team, along with technology that helps those individuals zero in on a smaller subset of plans that make sense for them, is something that it's important when you're considering offering ICHRA, making sure you have those tools and you have those resources available for employees.
Greg, is there any liability for a company that has an ICHRA that the employee may have been confused or says, well, I didn't understand, and I'm gonna, I engaged in this plan versus that plan, and if I would have known, therefore, you, the employer, are liable and you owe me whatever. How does that come into play?
Sure.
That might be that's a great question, right?
Oh yeah, for sure.
Okay.
Sure. No more than any other situation with any
Right.
sort of other health plan. I mean, again, I think it's the reminder that the health plan that's being offered by the employer is the ICHRA itself, the putting together $3,000 a year, $5,000 a year, whatever it is that's available. And then the selection, even if it might be guided or assisted to some point, it's always ultimately the individual selection to pick which individual health insurance policy is best for the individual. So, like any benefit offering, there's always a little bit of exposure. But for the most part, when you're limited to the benefits that are really available, that are being offered by the employer, is limited to that allocation of money, it's one of those things where, theoretically at least, your liability risks should be lower than in even other situations with a traditional health plan, especially if it's a traditional health plan that's self-funded by the employer as opposed to a fully insured plan.
Mm-hmm.
Yeah. So in fact, employers cannot restrict what qualified plans an employee can choose, right? They can choose any plan that qualifies for the reimbursement. And we're obligated to disclose that out of the gate. And make employees aware of that they are not restricted, and their employer is not restricting what they can purchase. So to Greg's point, it's really on the employee as an individual to pick a plan that's right for them. And that's why it's important to have offer
Concierge service.
Correct.
Yeah, right. No, that sounded very appealing. Okay, there was kind of a long question in the chat, but it looks interesting. Can you go over plan year versus benefit year again? If the ICHRA is being offered by the company, isn't there going to be an annual enrollment process? We have an off-calendar plan year, so I'm trying to envision how that will work with deductibles, et cetera. Would we have to change over to a 1/1 plan year?
Yep.
A 1/1 plan year, January 1st?
I can start with that, and Angela, maybe you can add some color to it. So yes, all plans, deductibles reset on January 1. The plan years is 1/1 to 12/31. So they are calendar year plans, both from a deductible reset. So there are several strategies you can deploy to look at making that transition from an off January 1 plan year. And so I won't go through them all today, but there are different solutions and different strategies to that that would help you transition. So whether or not you renew for the rest of the year, if that makes sense, it kind of depends on where people are at in meeting their deductibles. So there are different strategies that you can use to do that, and be happy to help with that at some point.
What's the minimum number of employees that you have to engage with an ICHRA?
You have to qualify as a group, so it can be as little as 2.
Yep, it's 2, and unless, you know, the part that I talked about earlier, where if you're going to offer the traditional group health plan with the ICHRA, then you get into that minimum size. But Ray's absolutely right. If you're just doing strictly the ICHRA, as a group plan, it just needs to be the 2.
Mm-hmm. So is there more information you could share, maybe Ray, on the cost structure? You know, is there a management fee, or kind of it's, I mean, this seems, you know, I'm sure people say this, Ray, this seems too good to be true. You know, I don't have to, as an employer, deal with some of these things. And for the most part, my costs are going to be low.
Yeah, so there are different models that are out there. So there are, and in a typical ICHRA offering, you're going to have an administrative fee, and depends on different companies calculate that differently, but you'd have an ICHRA administration fee. In most cases, your ICHRA solution provider is, because these are all individual products, they're in most cases they're required to be the broker, of record on those individual plans. But that doesn't mean that consulting firms that aren't appointed that way by their carriers can't be involved in this. We see a lot of consulting firms out there that are offering, basically setting up a consulting fee arrangement with their client to help them sort through all of this. And then the ICHRA solution providers is the one that's getting the commission from the insurance company on those, because they're required to sell the plan. You have to be appointed and be the broker for those individuals. So to sum that up, you might have a consulting fee from your broker advisor. You'd have an admin fee from your ICHRA solution provider, and in that, ICHRA solution provider is also receiving some commission from the insurance companies that they're representing.
But that's all baked into the example that you show in the slide deck.
Yeah. So all those fees are always disclosed, so people know exactly what they're paying, and that's all considered in a cost analysis.
Yeah.
Yep.
All right. So time for last words, and we're going to start with Greg. We're coming up to our time. So any last words, the future of this, any insights that employers need to know that you might have already talked about that are super important, or maybe things that you still want to address?
I would just add, Dan, that like anything in benefits, it's always changing and evolving. And I'm sure we'll get more guidance from the regulatory agencies. I mentioned a couple of proposed regulations that were sitting out there. Some of those have been in limbo since the beginning of this year in the changeover in administrations. So I imagine that we'll see more fleshing out of the ICHRA world in years to come. But I do think that they are here to stay. It's an adaptation of HRAs, which, as Ray said right away, is something that's been around for going on 20 years now in a formal standpoint. So I think we'll continue to see the ICHRA world expand and further get explained through regulatory guidance.
Great, thanks. Angela, last word.
Yeah, absolutely. I'm really happy to see Janet's comment in the chat there. So you're not throwing your employees to the wolves when they're going out for individual plans. They are comprehensive coverage that does provide a great benefit to your employees.
Yes, Janet was very positive in terms of their ICHRA that they have, and they use a TPA to track reimbursement for the employees. All right, so thank you very much, Angela. And Ray, you're going to send us home. Last word. You're muted, Ray.
Okay, I was going to just add, as an employer, I think knowing about ICHRA, that they're out there and they're a viable strategy to look at. I think whether or not you go down that road or not, I think having this information available to you is really important, because it may be the solution you're looking for. Again, may not be, but it's certainly something that you need to be aware of. And I think the other thing I want to leave people with, and we've talked a lot about all of the kind of little nits and complexities that go into something that's regulated by the federal government and the IRS, right? There's a lot there, but an ICHRA can look and feel to your employees like a traditional group plan. They just get more choice, right? And there's more transparency in the model for them. So it can be a very good thing. And so I don't want people to be scared off of looking at this because of the little complexities that are in there. All employee benefit plans have them. ICHRA is not an exception, but it can look very much streamlined, simplified, and like a traditional plan to your employees.
Yeah, as an employer, I mean, what harm would it be to look? I mean, I'm an employer, and why wouldn't we look at this as
Yeah, I mean, it's another option to look at and use to help you manage your benefit costs going forward.
All right. Well, thank you all. This concludes our webcast, and thanks to our presenters and partners. So Ray and Zizzle Health, Angela McKeegan, and Quartz, and Greg Storm, and Reinhard Berner Van Duren. So these are the experts. As you can tell, make sure to use them as a resource as you navigate through this renewal season. So you can find their contact information here. I know they've welcomed the opportunity to talk to you about this. They're happy to talk about issues related to employee benefits, employer health insurance, and certainly the ICHRA. As I mentioned earlier, the webcast recording will be available on our website later tomorrow morning, probably no later than early afternoon. And as we mentioned, the slide deck's available now. So we value your feedback, as I mentioned, and we look to have more webcasts like this in the future. So if you could fill out the attendee survey, which will open in the new tab once you close the webcast tab in your browser. So again, thanks so much on behalf of our webcast presenters and partners, Zizzle Health, Quartz, Reinhard Berner Van Duren, and BT360 Content Solutions. Thanks again for attending. Have a great rest of the day and great rest of the week. Thank you so much for coming.
Thanks, everyone.
Bye.
Thank you.